Introduction to Reactive Attachment Disorder, RAD. Reactive Attachment Disorder, RAD, is a profound mental health condition that impairs a child's ability to form healthy emotional bonds with caregivers. This disorder typically arises from early neglect, abuse, or frequent changes in caregivers during the critical developmental period of infancy and early childhood. RAD is marked by severe emotional withdrawal, difficulty in seeking comfort, and a pervasive inability to form normal attachments, leading to far-reaching consequences for the child's emotional, social, and cognitive development. Historical background of RAD. The conceptualization of RAD is deeply rooted in attachment theory, which was pioneered by John Bowlby in the mid-20th century. Bowlby's groundbreaking work established the importance of early relationships in shaping a child's psychological development. He proposed that children are biologically predisposed to develop attachments with caregivers as a mechanism for survival. These early attachments serve as the foundation for emotional regulation, social interactions, and future relationships. The recognition of RAD as a distinct disorder emerged in the 1980s, largely in response to observations of children who had been subjected to severe neglect or institutional care, where consistent caregiving was absent. These children exhibited a pattern of behaviors that deviated significantly from typical attachment behaviors, prompting the need for a specific diagnosis. RAD was officially recognized in the DSM-3 in 1980. With subsequent additions refining the diagnostic criteria to better capture the complexity of the disorder. Importance of understanding RAD. Understanding RAD is critical for several reasons. First, the disorder has profound implications for the affected child's mental health and development. Without appropriate intervention, children with RAD are at risk of developing more severe psychological issues, including mood disorders, anxiety, and conduct problems. Additionally, the impact of RAD extends beyond childhood, often leading to difficulties in forming and maintaining relationships, academic challenges, and an increased likelihood of engaging in high-risk behaviors during adolescence and adulthood. From a societal perspective, the consequences of untreated RAD can be substantial. Children with RAD may struggle in educational settings, requiring additional support and resources. As they grow older, these individuals may face difficulties in employment, social relationships, and overall functioning, which can contribute to a cycle of intergenerational trauma and dysfunction. Furthermore, early identification and intervention are crucial in mitigating the effects of RAD. Effective treatment can significantly improve outcomes for affected children, enabling them to develop healthier relationships and achieve greater emotional and social well-being. As such, it is essential for caregivers, educators, healthcare professionals, and policymakers to have a comprehensive understanding of RAD to support affected children and families. 1. Attachment theory and its development. Foundations of attachment theory. Attachment theory, first introduced by John Bowlby in the 1950s, revolutionized the understanding of the bond between children and their caregivers. Bowlby proposed that attachment behaviors are biologically driven, ensuring that children remain close to their caregivers for safety and survival. This theory was further expanded by Mary Ainsworth, who conducted the famous Strange Situations study, which identified different attachment styles in children: secure, avoidant, ambivalent, and disorganized. Secure attachment is characterized by a child's confidence in the availability of the caregiver, leading to a balance between exploring the environment and seeking comfort when needed. Avoidant attachment involves a child minimizing attachment behaviors, often appearing indifferent to the caregiver's presence or absence. Ambivalent attachment is marked by anxiety and uncertainty, with the child displaying clinginess or difficulty being comforted. Disorganized attachment, often linked to trauma or neglect, involves a lack of a coherent attachment strategy, leading to contradictory behaviors such as approaching the caregiver while looking away. Role of early childhood in attachment formation. Early childhood is a critical period for attachment formation. The first few years of life are when children develop their primary attachment relationships, typically with parents or other primary caregivers. These relationships are foundational for the child's development, influencing their ability to regulate emotions, form social bonds, and navigate stress. A secure attachment provides a safe base for the child to explore the world, while an insecure attachment can lead to difficulties in emotional and social development. When a child's early attachment experiences are disrupted through neglect, abuse, or instability, these disruptions can have long-lasting effects. Children who do not receive consistent and responsive caregiving may struggle to form secure attachments, leading to difficulties in emotional regulation, trust, and social interactions. These children may become hypervigilant to potential threats, withdrawn, or excessively clingy, behaviors that can persist into later childhood and beyond. Disrupted attachment and its consequences. Disrupted attachment occurs when a child's early experiences with caregivers are inconsistent, unresponsive, or harmful. Situations such as institutional care, frequent changes in caregivers, or severe neglect can prevent a child from forming a secure attachment. These experiences can lead to a range of emotional and behavioral problems, including RAD. Children with disrupted attachment may exhibit a range of behaviors, from extreme withdrawal and avoidance of relationships to excessive neediness and difficulty calming down. These behaviors are often adaptive responses to the child's environment, where consistent and responsive caregiving was lacking. However, without intervention, these patterns can become entrenched, leading to significant difficulties in later life. The consequences of disrupted attachment can be profound. Children with insecure or disorganized attachments are at increased risk for developing mental health disorders, including anxiety, depression, and personality disorders. They may also struggle with forming healthy relationships, both in childhood and later in life, as their early experiences have taught them that relationships are unpredictable or unsafe. Understanding the role of early attachment experiences is crucial for identifying and addressing RAD, as it provides insight into the underlying causes of the disorder. 2. Diagnostic criteria and clinical features of RAD. DSM-5 criteria for RAD. Reactive Attachment Disorder is recognized in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, under the category of trauma and stressor-related disorders. According to the DSM-5, RAD is diagnosed in children who have experienced a pattern of extreme neglect, abuse, or frequent changes in caregivers, leading to a persistent pattern of emotionally withdrawn behavior toward adult caregivers. The DSM-5 outlines several key diagnostic criteria for RAD. 1. A consistent pattern of inhibited, emotionally withdrawn behavior toward adult caregivers, manifested by rarely or minimally seeking comfort when distressed. Rarely or minimally responding to comfort when distressed. 2. A persistent social and emotional disturbance, characterized by at least two of the following: minimal social and emotional responsiveness to others. Limited positive affect. Episodes of unexplained irritability, sadness, or fearfulness that are evident during non-threatening interactions with adult caregivers. 3. The child has experienced a pattern of extremes of insufficient care, as evidenced by at least one of the following: social neglect or deprivation in the form of persistent lack of having basic emotional needs for comfort, stimulation, and affection met by caregiving adults. Repeated changes of primary caregivers that limit opportunities to form stable attachments, e.g., frequent changes in foster care. Rearing in unusual settings that severely limit opportunities to form selective attachments, e.g., institutions with high child-to-caregiver ratios. The caring criterion C is presumed to be responsible for the disturbed behavior in criterion A, e.g., the disturbances in criteria A and B began following the lack of adequate care described in criterion C. 5. The criteria are not met for autism spectrum disorder. 6. The disturbance is evident before age 5 years. 7. The child has a developmental age of at least 9 months. These criteria highlight the complexity of RAD and the need for careful assessment to differentiate it from other disorders, particularly autism spectrum disorder, which can present with some overlapping behaviors. Symptoms and signs of RAD. Children with RAD exhibit a range of symptoms that reflect their difficulties in forming healthy attachments. These symptoms can be broadly categorized into behavioral, emotional, and social domains. Behavioral symptoms. Withdrawal. Affected children may avoid eye contact, physical contact, and interactions with caregivers, preferring to be alone even when distressed. Avoidance of comfort. When upset, these children may not seek comfort from caregivers, or if comfort is offered, they may not respond to it, remaining distressed or emotionally flat. Lack of exploration. Children with RAD may show little interest in exploring their environment, particularly in the presence of caregivers, indicating a lack of a secure base from which to explore. Emotional symptoms. Flat effect. These children often display a limited range of emotions, showing little joy, excitement, or other positive emotions. Unexplained irritability or sadness. They may frequently appear sad, irritable, or fearful, even in situations that do not warrant such reactions, and these emotions may seem disconnected from any clear cause. Difficulty with emotional regulation. Affected children often struggle to manage their emotions, leading to frequent outbursts of anger, frustration, or inconsolable crying. Social symptoms. Difficulty forming peer relationships. Children with RAD may struggle to make friends or interact with peers, often displaying a lack of interest in social interactions or difficulty understanding social cues. Inappropriate interactions with strangers. In some cases, children with RAD may exhibit indiscriminate friendliness, showing little discernment between caregivers and strangers, which can be a sign of disorganized attachment rather than a secure attachment. Challenges in diagnosing RAD. Diagnosing RAD can be challenging for several reasons. The disorder often presents with symptoms that overlap with other mental health conditions, such as autism spectrum disorder, anxiety disorders, or developmental delays, making differential diagnosis essential. Moreover, the assessment of RAD requires a thorough understanding of the child's early caregiving experiences, which may not always be fully known or documented, particularly in cases of adoption or foster care. Furthermore, RAD can manifest differently depending on the child's environment. In a clinical setting, the child's behavior may differ from how they behave at home or in other settings, complicating the assessment process. Therefore, clinicians must use multiple sources of information, including caregiver reports, observations, and standardized assessment tools, to make an accurate diagnosis. The timing of the diagnosis is also crucial. RAD must be identified before the age of 5, as the symptoms typically emerge in early childhood. However, due to the subtle and complex nature of the disorder, it is not uncommon for RAD to be misdiagnosed or underdiagnosed, particularly in children who are not exposed to consistent caregiving. 3. Causes and risk factors. Environmental factors. The primary cause of RAD is a history of extreme neglect or abuse during early childhood. Environmental factors play a significant role in the development of the disorder, as children who do not receive consistent and responsive caregiving are at the highest risk. Neglect. Neglect is one of the most common environmental factors leading to RAD. This occurs when a child's basic emotional and physical needs are not met, such as when they are deprived of comfort, stimulation, or affection. In extreme cases, neglect can lead to the child feeling that they cannot rely on caregivers to meet their needs, which undermines the formation of secure attachments. Abuse, physical, emotional, or sexual abuse can also contribute to the development of RAD. Children who experience abuse may develop a deep mistrust of caregivers, associating adults with harm rather than safety. This mistrust can prevent them from forming healthy attachments, leading to the withdrawn and emotionally detached behaviors seen in RAD. Institutional care and foster care. Children raised in institutional settings, such as orphanages, or those who frequently move between foster homes, are particularly vulnerable to RAD. In these environments, the child may not have the opportunity to form stable attachments due to high caregiver turnover, a lack of individualized attention, or suboptimal caregiver-child ratios. These conditions can severely impair the child's ability to form healthy attachments, resulting in the symptoms of RAD. Biological and genetic influences. While environmental factors are the primary cause of RAD, biological and genetic influences may also play a role in the disorder's development. Some children may be more susceptible to the effects of neglect or abuse due to genetic predispositions or biological vulnerabilities. Genetic predispositions. Research suggests that certain genetic factors may increase a child's vulnerability to developing RAD in the presence of adverse environmental conditions. For example, variations in genes related to stress regulation, such as those involved in the hypothalamic pituitary adrenal (HPA) axis, may predispose some children to more severe reactions to neglect or abuse, increasing their risk of developing RAD. Biological factors. Children who have experienced prenatal exposure to substances such as alcohol or drugs, or who were born prematurely, may have biological vulnerabilities that make them more susceptible to the effects of early neglect. These factors can impair the child's ability to form secure attachments and regulate emotions, contributing to the development of RAD. Interaction of biological and environmental factors. It is important to note that RAD typically arises from the interaction between biological vulnerabilities and environmental stressors. A child with a genetic predisposition to stress dysregulation, for example, may be more likely to develop RAD in the context of neglect or abuse, whereas a child without such vulnerabilities might not develop the disorder despite experiencing similar adverse conditions. Socioeconomic and cultural factors. Socioeconomic and cultural factors also play a role in the development of RAD. Poverty, for example, can exacerbate the risk factors for RAD by increasing the likelihood of neglect, abuse, or instability in caregiving. Poverty and instability. Families living in poverty may face significant stressors, such as financial insecurity, housing instability, and limited access to healthcare, which can impair their ability to provide consistent and responsive caregiving. Additionally, children in these families may experience frequent moves, changes in caregivers, or other forms of instability that increase their risk of developing RAD. Cultural attitudes towards child-rearing. Cultural factors can also influence the development of RAD. In some cultures, for example, there may be less emphasis on emotional expression or physical affection, which can affect the attachment process. Additionally, cultural beliefs about discipline or child-rearing practices may contribute to neglect or abuse in some cases, further increasing the risk of RAD. Global perspectives on RAD. The understanding and recognition of RAD vary globally, influenced by cultural attitudes towards child development and mental health. In some countries, RAD may be underdiagnosed or misunderstood due to a lack of awareness or different conceptualizations of attachment and mental health. This highlights the importance of culturally sensitive approaches to diagnosing and treating RAD, as well as the need for global awareness and education about the disorder. 4. Impact of RAD on child development. Emotional and behavioral outcomes. The impact of RAD on a child's emotional and behavioral development is profound. Children with RAD often struggle with emotional regulation, which can lead to significant behavioral challenges. Emotional dysregulation. One of the core features of RAD is difficulty with emotional regulation. Affected children may experience intense emotions, such as anger, sadness, or fear, but struggle to manage these feelings appropriately. This can result in frequent emotional outbursts, withdrawal, or prolonged periods of distress. These difficulties often persist into adolescence and adulthood if not addressed, leading to challenges in relationships and daily functioning. Behavioral problems. Children with RAD may exhibit a range of behavioral problems, including aggression, defiance, and oppositional behavior. These behaviors are often a manifestation of the child's underlying emotional distress and difficulty forming secure attachments. In some cases, these behaviors can escalate to more severe conduct problems, such as delinquency or substance abuse, particularly during adolescence. Long-term implications for social relationships. RAD has significant long-term implications for a child's ability to form and maintain social relationships. The disorder's impact on attachment formation can lead to difficulties in developing trust, empathy, and social skills, which are essential for healthy relationships. Difficulty forming trust. Children with RAD often struggle to trust others, including peers and adults. This lack of trust can make it difficult for them to form close friendships or maintain relationships, leading to social isolation and loneliness. These challenges can persist into adulthood, affecting the individual's ability to form intimate relationships or build a supportive social network. Impaired empathy and social understanding. RAD can also impair a child's ability to understand and respond to the emotions of others. This lack of empathy can make it difficult for the child to engage in reciprocal social interactions, leading to misunderstandings, conflicts, and difficulties in forming meaningful connections with others. Challenges in peer relationships. Children with RAD may have difficulty navigating the complexities of peer relationships, particularly during adolescence when social dynamics become more intricate. They may struggle with social cues, have difficulty managing conflicts, or engage in inappropriate social behaviors, further isolating them from their peers. Cognitive development. RAD can also impact cognitive development, particularly in areas related to learning, attention, and executive functioning. Learning difficulties. Children with RAD may struggle academically due to their emotional and behavioral challenges. The stress and anxiety associated with the disorder can impair concentration, memory, and problem-solving abilities, leading to difficulties in school. Additionally, the lack of a secure attachment may result in low self-esteem or a lack of motivation, further exacerbating academic challenges. Attention and executive functioning. RAD can also affect attention and executive functioning, which are crucial for academic success in daily life. Children with RAD may have difficulty focusing on tasks, organizing their thoughts, or managing time effectively. These challenges can persist into adolescence and adulthood, affecting educational attainment, employment, and overall functioning. Impact on academic performance. The combination of emotional dysregulation, behavioral problems, and cognitive challenges can significantly impact a child's academic performance. Children with RAD may require additional support in school, such as individualized education plans, IEPs, or specialized interventions, to address their unique needs and help them succeed academically. Physical health consequences. The effects of RAD are not limited to emotional, behavioral, and cognitive development. The disorder can also have physical health consequences. Psychosomatic symptoms. Children with RAD may experience psychosomatic symptoms, such as headaches, stomachaches, or other physical complaints that do not have a clear medical cause. These symptoms are often a manifestation of the child's underlying emotional distress and anxiety. Chronic stress and its effects on health. Chronic stress, which is common in children with RAD, can have long-term effects on physical health. Prolonged exposure to stress hormones, such as cortisol, can weaken the immune system, increase the risk of chronic illnesses, and affect the development of the brain and other organs. These effects can persist into adulthood, increasing the risk of health problems such as heart disease, diabetes, and mental health disorders. Risk of high-risk behaviors. As children with RAD grow older, they may be more likely to engage in high-risk behaviors, such as substance abuse, self-harm, or reckless behavior, as a way to cope with their emotional pain. These behaviors can further compromise their physical health and increase the risk of injury, illness, or death. 5. Treatment and intervention strategies. Therapeutic approaches. Effective treatment of RAD requires a multifaceted approach that addresses the child's emotional, behavioral, and social needs. Several therapeutic approaches have been developed to treat RAD, each with its strengths and challenges. Attachment-based therapy. Attachment-based therapies focus on improving the relationship between the child and their caregiver. These therapies aim to help the child develop a secure attachment by fostering trust, improving communication, and addressing the emotional wounds caused by neglect or abuse. Techniques such as dyadic developmental psychotherapy, DDP, developed by Daniel Hughes, are commonly used in this approach, which involves the caregiver actively participating in therapy to rebuild the attachment bond. Trauma-focused cognitive behavioral therapy, TFCBT. TFCBT is a widely used therapeutic approach for children who have experienced trauma, including those with RAD. This therapy helps the child process and make sense of their traumatic experiences, develop coping strategies for managing distressing emotions, and improve their ability to form healthy relationships. TFCBT often involves the caregiver and may include components such as psychoeducation, relaxation techniques, and cognitive restructuring. Play therapy. Play therapy is a therapeutic approach that uses play as a means of helping the child express emotions, explore relationships, and resolve conflicts. For children with RAD, play therapy can provide a safe and supportive environment where they can work through their attachment issues and develop healthier ways of relating to others. Play therapy is particularly effective for younger children who may have difficulty expressing their feelings verbally. Family therapy. Family therapy involves working with the entire family to address the dynamics that contribute to the child's RAD. This approach helps improve communication, reduce conflicts, and build stronger, more supportive relationships within the family. Family therapy can be particularly beneficial when there are multiple caregivers involved or when the child has been adopted or placed in foster care, as it can help create a more stable and nurturing environment for the child. Behavioral interventions. Behavioral interventions focus on modifying the child's behavior by reinforcing positive behaviors and reducing negative ones. These interventions often involve setting clear expectations, providing consistent consequences for behavior, and using positive reinforcement to encourage desired behaviors. Behavioral interventions can be effective in helping children with RAD develop better emotional regulation and social skills. Pharmacological interventions. While there is no specific medication for RAD, pharmacological interventions may be used to manage some of the symptoms associated with the disorder, such as anxiety, depression, or aggression. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, may be prescribed to children with RAD who experience significant symptoms of depression or anxiety. These medications can help improve mood, reduce anxiety, and increase emotional stability, making it easier for the child to engage in therapy and build healthy relationships. Antipsychotics, in cases where the child exhibits severe behavioral problems, such as aggression or extreme emotional dysregulation, antipsychotic medications may be considered. These medications can help reduce aggression and stabilize mood, but they are typically used with caution due to potential side effects and the importance of addressing the underlying attachment issues through therapy. Stimulants, for children with RAD who also have symptoms of attention deficit/hyperactivity disorder, ADHD, stimulant medications may be prescribed to help improve focus and reduce impulsivity. These medications can support the child's ability to engage in therapy and succeed in school, but they are not a primary treatment for RAD. Integrating medication with therapy. When medication is used in the treatment of RAD, it is typically part of a comprehensive treatment plan that includes therapy and other interventions. Medication can help manage specific symptoms, but it is not a substitute for addressing the underlying attachment issues through therapeutic approaches. Careful monitoring and collaboration between the prescribing physician, therapist, and caregivers are essential to ensure that the child receives the most effective and appropriate treatment. Support for caregivers. Supporting caregivers is a critical component of treating RAD. Caregivers play a central role in the child's recovery, and they often need guidance and support to manage the challenges of caring for a child with RAD. Education and training. Providing caregivers with education and training on RAD, attachment theory, and effective parenting strategies is essential. Caregivers need to understand the nature of the disorder, the importance of consistency and responsiveness, and how to manage challenging behaviors. Training can also help caregivers develop the skills needed to build a secure attachment with the child and support their emotional and behavioral development. Support groups. Support groups for caregivers of children with RAD can provide a valuable source of emotional support, practical advice, and shared experiences. These groups offer a space where caregivers can connect with others facing similar challenges, learn from each other, and gain encouragement and validation. Support groups can also help reduce feelings of isolation and stress, which are common among caregivers of children with RAD. Respite care. Caring for a child with RAD can be physically and emotionally exhausting. Respite care provides caregivers with temporary relief by offering professional care for the child, allowing the caregivers to rest and recharge. This support is crucial for preventing burnout and ensuring that caregivers can continue to provide the consistent and responsive care that the child needs. Therapy for caregivers. Caregivers may also benefit from individual therapy to address their own emotional needs, process the stress and challenges of caring for a child with RAD, and develop healthy coping strategies. Therapy can help caregivers manage their emotions, maintain their well-being, and be better equipped to support the child's recovery. School-based interventions. Children with RAD often face challenges in educational settings, requiring tailored interventions to support their academic and social development. Individualized education plans, IEPs. IEPs are formalized plans that outline specific educational goals and support services for children with disabilities, including those with RAD. IEPs may include accommodations such as extra time for assignments, small group instruction, or behavioral support to help the child succeed academically. Teachers and school staff should be trained to understand RAD and implement the strategies outlined in the IEP effectively. Behavioral support plans. Behavioral support plans are often a component of IEPs for children with RAD. These plans outline strategies for managing the child's behavior in the classroom, such as positive reinforcement, clear expectations, and consistent consequences. Behavioral support plans aim to create a structured and supportive learning environment that helps the child manage their emotions and behaviors more effectively. Counseling and support services. Schools can provide counseling and support services to help children with RAD develop social skills, emotional regulation, and coping strategies. School counselors, psychologists, and social workers can work with the child individually or in small groups to address their unique needs. Collaboration between the school and the child's therapist is essential to ensure consistency in the support provided across different settings. Collaboration with caregivers. Effective communication and collaboration between the school and the child's caregivers are crucial for ensuring that the child's needs are met both at home and in the educational setting. Regular meetings, progress updates, and a shared understanding of the child's challenges and strengths can help create a coordinated and supportive approach to the child's development. Community and social support. Building a strong support network is essential for children with RAD and their families. Community and social support can provide additional resources, connections, and opportunities for healing and growth. Community programs and services. Community-based programs, such as after-school activities, mentoring programs, and recreational opportunities, can provide children with RAD with positive social experiences and opportunities to develop new skills. These programs can also offer respite for caregivers and a supportive environment where the child can practice social interactions in a structured setting. Faith-based and cultural organizations. Faith-based and cultural organizations can provide a sense of community, belonging, and support for children with RAD and their families. These organizations often offer programs, services, and resources that align with the family's values and beliefs, which can be particularly helpful in addressing the emotional and spiritual needs of the child and caregivers. Advocacy and awareness. Advocacy and awareness efforts are crucial for increasing understanding of RAD within the community. By raising awareness of the disorder, its causes, and the needs of affected children and families, communities can become more supportive and inclusive. Advocacy efforts can also help reduce stigma and promote early identification and intervention, improving outcomes for children with RAD. 6. Case studies and real-life examples. Case Study 1, a child adopted from an orphanage. This case study explores the journey of a child adopted from an orphanage who developed RAD due to early neglect and inconsistent caregiving. The study examines the challenges faced by the adoptive family, the therapeutic interventions used, and the child's progress over time. Background: the child, a 4-year-old boy, was adopted from an orphanage in Eastern Europe. He had spent the first 3 years of his life in the orphanage, where he experienced severe neglect, limited social interaction, and frequent changes in caregivers. Upon adoption, the child exhibited symptoms of RAD, including withdrawal, avoidance of comfort, and emotional dysregulation. Intervention: the adoptive family engaged in attachment-based therapy, focusing on building a secure attachment with the child. The therapy involved weekly sessions with a therapist, parent-child interaction therapy, PCIT, and participation in a support group for adoptive parents. The family also implemented a consistent routine, clear boundaries, and positive reinforcement strategies at home. Outcome: over 2 years of therapy, the child made significant progress. He became more responsive to comfort, started to form a secure attachment with his adoptive parents, and showed improvements in emotional regulation. While challenges remained, such as occasional outbursts and difficulties in peer relationships, the child's overall well-being and attachment behaviors improved substantially. Case Study 2, a foster child with a history of abuse. This case study follows the story of a foster child who developed RAD after experiencing physical and emotional abuse in her birth home. The study highlights the impact of trauma on attachment and the role of foster care in providing a stable and supportive environment. Background: the child, a 7-year-old girl, entered the foster care system after being removed from her birth home due to severe physical and emotional abuse. Upon entering foster care, she exhibited symptoms of RAD, including aggression, defiance, and difficulty forming trusting relationships with her foster caregivers. Intervention: the foster family worked with a therapist specializing in trauma-focused cognitive behavioral therapy, TFCBT. The therapy focused on helping the child process her traumatic experiences, develop coping strategies, and build trust with her foster caregivers. The foster parents received training on managing RAD behaviors, maintaining consistency, and providing emotional support. Outcome: after 1 year of therapy, the child showed significant improvements in her behavior and emotional regulation. She developed a trusting relationship with her foster parents, became less aggressive, and started to form positive relationships with peers. The therapy also helped the child build a sense of safety and security, which was crucial for her ongoing development and healing. Case Study 3, A Biological Child with RAD. This case study examines the experience of a biological child who developed RAD despite being raised in a stable home environment. The study explores the potential role of genetic and biological factors in the development of RAD and the challenges faced by the family. Background: the child, a 5-year-old girl, was raised by her biological parents in a loving and stable home. Despite this, she exhibited symptoms of RAD, including emotional withdrawal, difficulty forming attachments, and frequent mood swings. The family had no history of neglect or abuse, leading to the consideration of biological factors in the development of the disorder. Intervention: the family engaged in a comprehensive assessment, including genetic testing and evaluations by a child psychologist. The child was diagnosed with a genetic predisposition to stress dysregulation, which, combined with early challenges in emotional regulation, contributed to the development of RAD. The family participated in attachment-based therapy and received support from a pediatric psychiatrist for medication management. Outcome: the child made gradual progress in therapy, with improvements in emotional regulation and attachment behaviors. The family learned to navigate the challenges of RAD, incorporating strategies to support the child's emotional needs and build a secure attachment. The case highlighted the complexity of RAD and the importance of considering both environmental and biological factors in its development and treatment. 7. Prevention and early intervention. Importance of early identification. Early identification and intervention are crucial in preventing the development of RAD and mitigating its long-term effects. Recognizing the signs of attachment difficulties in infants and young children can lead to timely support and intervention, reducing the risk of RAD. Recognizing early signs: healthcare providers, including pediatricians, nurses, and early childhood educators, play a critical role in identifying early signs of attachment difficulties. These signs may include a lack of responsiveness to caregivers, difficulty soothing, limited eye contact, and a lack of interest in social interactions. Early screening tools and assessments can help identify children at risk for RAD and other attachment disorders. Parental education and support. Providing parents with education and support on the importance of attachment and responsive caregiving is essential for prevention. Parenting programs that focus on building secure attachments, managing stress, and promoting healthy child development can help reduce the risk of RAD. These programs can be offered through healthcare settings, community organizations, and early childhood education programs. Intervention in high-risk situations. Intervening in high-risk situations, such as cases of neglect, abuse, or unstable caregiving environments, is critical for preventing RAD. Early intervention can help address the root causes of attachment difficulties and support the child's emotional and social development. Child Protective Services. Child Protective Services, CPS, play a crucial role in identifying and intervening in cases of neglect or abuse. When a child is removed from an unsafe environment, CPS can work with healthcare providers, therapists, and foster care agencies to ensure that the child receives the support needed to prevent the development of RAD. This may include placing the child in a stable and nurturing foster home, providing trauma-informed care, and offering therapy to address attachment issues. Foster care and adoption. Foster care and adoption agencies can also play a vital role in preventing RAD by providing training and support to foster and adoptive parents. Ensuring that children are placed in stable, nurturing environments with caregivers who are educated about attachment and trauma can significantly reduce the risk of RAD. Additionally, providing ongoing support and resources to foster and adoptive families can help them navigate the challenges of caring for a child with attachment difficulties. Community-based programs. Community-based programs that focus on early childhood development, parenting support, and mental health can be instrumental in preventing RAD and promoting healthy attachments. Early childhood education programs such as Head Start, Early Head Start, and other early childhood education initiatives provide critical support for children and families, particularly those living in poverty or facing other challenges. These programs offer a range of services, including developmental screenings, parenting support, and access to mental health resources, which can help identify and address attachment difficulties early on. Home visiting programs, such as those provided by nurse-family partnerships, offer in-home support and education to parents of young children. These programs focus on promoting healthy parent-child interactions, supporting child development, and providing resources to address challenges such as stress, mental health, and substance abuse. By supporting parents in the early years, home visiting programs can help prevent attachment difficulties and reduce the risk of RAD. Health services for parents. Providing mental health services for parents is an essential component of preventing RAD. Parents dealing with mental health issues such as depression, anxiety, or trauma may struggle to provide consistent and responsive caregiving, which is crucial for the development of secure attachments. By offering accessible mental health support to parents, communities can help ensure that they are emotionally and mentally equipped to care for their children. This support can include therapy, counseling, support groups, and, when necessary, medication management. Parenting classes and support groups. Parenting classes and support groups can provide valuable education and emotional support for parents, particularly those facing challenges such as single parenthood, poverty, or a history of trauma. These classes can teach parents about the importance of attachment, strategies for managing stress, and techniques for fostering healthy child development. Support groups offer a space for parents to share their experiences, receive advice, and build a community of support, which can be especially important for those raising children with attachment difficulties. Building resilience in children. Building resilience in children is a key strategy for preventing RAD and other attachment disorders. Resilience refers to a child's ability to cope with adversity, manage stress, and adapt to challenging situations. By fostering resilience, caregivers and communities can help children develop the skills they need to form healthy attachments and thrive in the face of challenges. Promoting secure attachments. Secure attachments provide the foundation for resilience. Children who feel safe and supported by their caregivers are more likely to develop the confidence and emotional regulation needed to navigate challenges. Caregivers can promote secure attachments by being consistently responsive to the child's needs, providing comfort and support, and creating a stable and nurturing environment. Encouraging social connections with peers, extended family, and community members can also help build resilience in children. Positive relationships outside the immediate family provide additional sources of support, opportunities for social learning, and a sense of belonging. Encouraging children to participate in group activities, such as sports, clubs, or community programs, can help them develop these important social connections. Teaching children coping skills, such as problem-solving, emotional regulation, and stress management, can help them navigate difficult situations and reduce the risk of developing attachment issues. Caregivers and educators can model these skills, provide opportunities for practice, and offer guidance and support as children learn to manage their emotions and reactions to stress. Access to mental health services. Ensuring that children have access to mental health services when needed is essential for preventing RAD and other attachment disorders. Early intervention with mental health support can address emerging emotional and behavioral issues, provide the child with coping strategies, and prevent the escalation of attachment difficulties. This access should be readily available in schools, community health centers, and through pediatric care. Support for high-risk families. Supporting high-risk families, those facing challenges such as poverty, domestic violence, substance abuse, or mental illness, is critical for preventing RAD. These families may struggle to provide the consistent and nurturing care needed for healthy attachment, and without support, their children are at a higher risk for developing attachment disorders. Comprehensive family support programs. Comprehensive family support programs that address the multifaceted needs of high-risk families can be highly effective in preventing RAD. These programs may offer a combination of financial assistance, housing support, mental health services, substance abuse treatment, and parenting education. By addressing the root causes of stress and instability in the family, these programs can help create a more secure and supportive environment for children. Collaboration between services. Collaboration between social services, healthcare providers, schools, and community organizations is essential for providing high-risk families with the coordinated support they need. This collaboration ensures that families receive consistent and comprehensive care, with all service providers working together to address the family's needs and prevent the development of RAD. Early intervention and prevention strategies for foster and adoptive families. Foster and adoptive families face unique challenges in preventing RAD, particularly when caring for children who have already experienced trauma, neglect, or multiple placements. Early intervention and targeted prevention strategies can help these families build strong attachments and support the child's emotional and behavioral development. Pre-adoption counseling and training. Providing pre-adoption counseling and training for prospective adoptive parents can help them understand the challenges they may face and prepare them to care for a child with a history of attachment difficulties. This training should cover topics such as the impact of trauma on attachment, strategies for building secure attachments, and how to manage challenging behaviors. Support during transition. The transition into a new family can be a critical time for a child with a history of attachment difficulties. Providing additional support during this period, such as in-home counseling, attachment-based therapy, and respite care, can help the child and family navigate the challenges of this transition and begin building a secure attachment. Post-adoption services. Post-adoption services are essential for supporting adoptive families in the long term. These services can include ongoing counseling, support groups, educational resources, and access to mental health care. By providing continued support, adoption agencies can help prevent the development of RAD and ensure that families have the resources they need to thrive. Training for foster caregivers. Foster caregivers play a crucial role in preventing RAD in children who have experienced trauma or neglect. Providing foster caregivers with specialized training on attachment, trauma-informed care, and managing challenging behaviors can equip them to create a stable and nurturing environment for the child. Ongoing support, including access to counseling and respite care, is also important for helping foster caregivers manage the challenges of caring for a child with attachment difficulties. Creating a supportive environment in schools. Schools can play a significant role in preventing RAD by creating a supportive and nurturing environment for children. Educators, school counselors, and administrators can work together to identify children at risk for attachment difficulties and provide the support they need to succeed academically and socially. Training for educators. Training educators on the signs of attachment difficulties and the impact of trauma on learning and behavior is essential for early identification and intervention. Educators should be equipped with strategies for creating a supportive classroom environment, managing challenging behaviors, and building positive relationships with students. School-based mental health services. Providing school-based mental health services, such as counseling and therapy, can help address the emotional and behavioral needs of children with attachment difficulties. Schools can partner with community mental health organizations to offer these services on-site, ensuring that students have easy access to the support they need. Social-emotional learning programs. Social-emotional learning (SEL) programs can help all students, including those at risk for RAD, develop the skills they need to manage emotions, build positive relationships, and make responsible decisions. Implementing SEL programs in schools can create a more supportive and inclusive environment, reduce the risk of attachment difficulties, and promote overall well-being. Collaboration with parents and caregivers. Schools should work closely with parents and caregivers to support children with attachment difficulties. Regular communication, parent-teacher conferences, and collaborative problem-solving can help ensure that the child receives consistent support both at home and in the classroom. Schools can also provide resources and referrals for additional support services, such as therapy or parenting classes. 8. Conclusion and future directions. Summary of key points. This chapter will summarize the key points discussed throughout the book, reinforcing the importance of understanding, diagnosing, and treating reactive attachment disorder, RAD. The summary will emphasize the need for a comprehensive, multifaceted approach that includes early identification, therapeutic interventions, caregiver support, and community-based resources. The importance of continued research. The chapter will highlight the importance of continued research in the field of attachment disorders. Understanding the underlying causes of RAD, including genetic, biological, and environmental factors, is crucial for developing more effective interventions. Research into the long-term outcomes of children with RAD and the effectiveness of various treatments will also be discussed. Advocacy for policy changes. The conclusion will advocate for policy changes that support early intervention, mental health services, and support for high-risk families. It will emphasize the need for increased funding for mental health services, training for professionals, and resources for caregivers. Advocacy efforts aimed at raising awareness of RAD and promoting the rights of children to receive the care and support they need will also be discussed. Future directions for treatment and prevention. This section will explore future directions for the treatment and prevention of RAD. It will discuss the potential for new therapeutic approaches, such as trauma-informed care, advancements in attachment-based therapies, and the integration of technology in treatment. The role of early childhood education, community programs, and policy initiatives in preventing RAD will also be highlighted. Final thoughts. The book will conclude with a message of hope and encouragement for caregivers, professionals, and communities working with children with RAD. It will emphasize the importance of patience, understanding, and commitment to helping these children heal and thrive. The final thoughts will reinforce the idea that with the right support and interventions, children with RAD can develop healthy attachments and lead fulfilling lives. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.